This is Phil Giese, the CEO of the Edgewood Group of Companies. This PowerPoint and demonstration are a supplement to the Rural Health Transition Program grants submitted by Edgewood or Legacy Medical. What I'd like to do is provide information on who the companies are, the vertical and virtual integration concept we're using together, do a demo on the CarePredict and CamiCare devices, which are being purchased, and how it ties into the Aspire clinical intelligence system, and how data and AI are used across the platform. Finally, I'll talk about the quality and cost metrics that we're seeing. Edgewood Healthcare is a Grand Forks-based company. It's privately owned with about 80 investors. We built the Edgewood Vista in Minot back in 1993. We still own it and operate it today. We operate about 5,000 beds in 51 cities across the Midwest. And we are also owned by the 1889 Growth Fund, which owns 3% of Edgewood Healthcare. We operate as a vertically and virtually integrated company within senior care. So in the middle, we have our home-based patients in independent living, assisted living, memory care, and basic care. And all of our buildings are led by a medical director, which is supplied by Legacy Medical, a separate company. Legacy Medical also provides all the in-home primary care that is done in the building. The nurse practitioners or physicians in Legacy Medical do home care exclusively in Edgewood facilities and in other facilities across the upper Midwest. By virtual integration, I'm talking about the virtual partners we have. Alice is our electronic health record. It's a company out of Chicago. We utilize CarePredict, which is based in Florida, and a VistaScale, which is a new startup owned by the company. These companies do our remote nurse monitoring and our dynamic health record, and provides clinical intelligence through Aspire Clinical Intelligence, and Edgewood Company started about 5 years ago. We also provide therapies, home health, hospice, and palliative care through owned entities or through partners throughout the upper Midwest. Legacy Medical is a mobile primary care practice. It's a clinic without walls located within the assisted living facilities that they provide services to. The company is owned by Dr. Aaron Morehouse, who owns Legacy Medical PLLC, a North Dakota professional limited liability company. His son Blaine owns Legacy Primary Care PLLC, also domiciled in North Dakota. Together, they operate Legacy Medical across 5 states. Jill Chandler is a Chief Operating Officer. Jill lives in Grand Forks. Amanda Gardner is the VP of Clinical Operations, and she lives in Bismarck. These are the current providers that provide care in North Dakota, Minnesota, South Dakota, and Wyoming. So these 20 individuals will do about 35,000 home visits this year. They're adding 6 more nurse practitioners in North Dakota, primarily Minnesota and South Dakota. These are the services provided by Legacy Medical. First of all, of course, they provide legacy primary care within each building, including Idaho, and they're growing in Arizona and Utah as well. They have 30 physicians and nurse practitioners that provided about 50,000 in-home visits within facilities in 2025. And these buildings are providing express care, chronic care management, palliative care, and 24/7 support through telehealth. Legacy Medical also owns a Grand Forks-based call center. This is a remote nursing service call center that's open from late afternoon until mid-morning every day of the week, plus all day on Saturday and Sunday. It is a nurse on-call and triage support system for assisted living and basic care throughout the upper Midwest. They cover all 70 buildings owned by Edgewood, plus another 35 that are owned by other operators in the region. The nurses, there's 20 nurses in the call center. Most of them actually work out of their homes at night and on weekends. These are RNs who are experienced in the ER and critical care units. So they've seen a lot of things in the past, and they're able to provide on-call and triage support, which is augmented by significant data that they receive on these patients, which is coming from the devices and the technology that are installed in the systems. So the third area they have that Legacy Medical provides in the facilities is clinical dashboards, wearable devices like CarePredict and others, and nearable devices like Invisiscale to gather biometric monitoring, location monitoring, and data from the electronic health record to better manage patients. Finally, Legacy Medical is part of an ACO, or Medicare Shared Savings Program, that's operated by Corona Health in the upper Midwest. Okay, so now I would like to talk about CarePredict and the CammaCare devices, and importantly, how they tie into the clinical intelligence systems where all the data is and our artificial intelligence tools are used. The hardware that's utilized, the devices themselves, are provided by CarePredict and CammaCare, and there may be others RPM devices they utilize as well. But CarePredict is a resident wearable device. This is called the Tempo. At the top of the Tempo is a button that the resident can push at any time if they need assistance. So CarePredict replaces the call systems that are currently in the facilities. The power behind monitoring the residents and the location in the building comes from this beacon. The beacon is located about 7 feet high along the walls throughout the building and through the apartments. In fact, in a typical 150 bed assisted living facility, there might be 500 beacons located throughout the building. The beacon, through infrared light, communicates with the Tempo. The Tempo then communicates directly with the Wi-Fi to provide continuous biometric monitoring, continuous location analysis of every resident throughout the day. The Tempo has a removable battery that is recharged in the patient room, and the staff or the resident change that battery out on a daily basis. The staff carry smartphones or iPads that are directly communicated with the Tempo. So if a resident needs assistance and they hit their call light, it goes to all the staff in the facility, and the facility staff respond through voice. They can talk to the resident through the Tempo. And then when they physically respond to the resident, the staff clicks the Tempo 3 times, which puts a date stamp on how quickly the staff member made it to the resident's room or to wherever the resident is to provide assistance. The other device is CamiVision. Cami is another company that specializes in cameras, and Legacy Medical is utilizing it in the memory care buildings for fall detection. So the camera is mounted in the patient's room, and it identifies if somebody's laying on the floor or who has fell through a digital format. That information is sent to a call center, CammaCare's call center, who verify whether it was a fall or not, And then if it is a fall, that video is sent directly to the CarePredict smartphone so that the staff can see the fall and they can respond to the fall as quickly as possible. I'd like to now do a demo on CarePredict and how it's used in the facilities. So this is the CarePredict system on the screen. And what you see here is the Edgewood facility in Grand Forks. It's a 3-level facility with 142 assisted living, basic care, and memory care beds. The information is de-identified, so the patient names are scrambled, the locations are scrambled, and the staff members' names are scrambled. First of all, let's look at the beacon map. Okay, this is the location of all of the beacons in the facility on the first floor of the building. Again, this is the little square white infrared monitor. And you'll notice that in the apartments, there might be 3 beacons. This apartment 104 has a beacon in the bedroom, the bathroom, and the living room. The infrared does not go through walls, which is an advantage because that allows us to have pinpoint accuracy of where the resident is. The beacons are in all the hallways, so we can even measure how long it takes residents to walk the hallways. Throughout the dining room and also in the common areas, the theater area, the wellness center, the chapel, even the coffee shop next door, and access to the Sanford Clinic on this side. As you can see in red, some of these monitors, the battery levels going down. This system tells us when to change the battery in each beacon. What I'd like to show you next is the power behind the locating devices in the building and how resident data is measured throughout the day. So what I'm going to do is I'm going to look at the last 24 hours along the bottom here. So yesterday, August 9th, starting at 3:59 p.m. to today, I'm going to replay all the movement in the building for the last 24 hours. I'm going to select all the residents. All the residents pop up so we can see where they're at. I'm going to play 16 times actual speed. So here you'll see the residents moving out throughout the building. This is last night about 6 o'clock, so a lot of people were in the dining room. Now they were leaving back to their apartments. On every level of the building, you can watch the movement. You can see the slight movement within each apartment. That means the resident is going from their living room to the bathroom or to the bedroom. So last night about 1 o'clock in the morning, there's not much movement. Now, an important feature of the system is contact tracing. Since we measure where everybody is in the building 24/7, we know when people are near each other. So this, at 8:50, between 8:50 and 9 o'clock p.m. yesterday, all these 9 residents were next to each other. These 2 residents were next to each other at 9:24, 9:27. These residents were together in the morning, likely in the dining room. So the power of this system is continual contact tracing. If there's an outbreak, a pandemic, or we just want to go back and see where a resident has been and who they've been with, we have that data. And by the way, that orange note coming across the screen is a resident request for help or assistance. There, that's the movement over the last 24 hours. I can also select the staff, and we can also watch the staff movement throughout the building because the staff members are required to wear a tempo, although it may not be on their wrist, it may be on their lapel, because they use that for communication. And it also allows us to track the staff members throughout the day and all of their activities. Now, if we go to the dashboards that are provided in the system, first I'm going to go to the care team insights. Now, because the staff members wear the tempos and they have a smartphone with them, the staff are entering data on the system all day long, including how their day is. So residents are asked about challenges they're having during the day, the good and the bad, and this creates a sentiment score of each staff member throughout the day. So at the end of the day, or the next day, the management can take a look at this. Again, these are employees, de-identified, and this employee had the lowest sentiment score in the building. So obviously, management needs to pay attention to that employee, visit with them, and find what we can do to improve their work environment and improve care to the residents. It has the staff members with the highest sentiment score. It also shows the staff who spend the most time with residents based on the tempo and the locating devices. Okay. CarePoint is all about on-demand care. So during the day, as residents are using their call light on the tempo, the system tracks the calls, where they're coming from, the time of day, and which residents are using the tempo the most. The daily stand-up report is an important dashboard that's used by the nurse practitioners and the caregivers in the building every day. So this shows for the last week the number of assistance requests from the facilities, how it compares to the week before. And it actually highlights the residents with the most number of alerts. So this resident had 24 alerts over the last week. It shows the number with the residents with the most increased number of alerts. It looks at falls detected. It looks at UTI risk, which I'll talk about in a little bit, depression, and nutrition risk. So this is the report that the nurse practitioners use and their nurses to guide them to who they should see during the day. The on-demand care dashboard really tracks over the last 24 hours the number of events in the building. So these are 85 times in the last 24 hours, a resident hit their call light for assistance. So we're tracking how quickly it takes the staff to respond to the call lights, including physically how quickly the residents get how quickly the staff members get to the residents, so we can track time and care levels. So of the 85 events in the last 24 hours, 27 were simply for escorting. And on average, the staff spent 8 minutes with the residents, each resident that needed help escorting. So total yesterday, they spent 3 hours and 36 minutes with the residents, escorting them in the building. There's exceptions, there's medication, there's toileting, transferring other ADLs that the residents need assistance with. Now with this, we can look at the residents that are using the system the most. This resident used his or her call light 11 times yesterday. And because of this, the staff spent a total of 6 hours and 7 minutes with this resident. That was outside of their normal care planning duties. So again, these on-demand cares are cares up and above the normal ADL assistance that are provided to the residents every day. So we see the residents, we can look at why they're making their calls, and even drill down on what times of the day. Now, because the staff members are tied into the system, I can go down here, and this staff member of the 85 events responded to 10 of them. He or she spent 3 hours and 43 minutes directly with residents responding to their needs. So you have all the staff members there. Okay, the resident risk dashboard really looks at baseline trends from the residents, from the data that's coming from the wearable devices, and identifying areas through AI where there might be risks. So let's just take one here. Let's take this second one. This resident is out of range in 3 of her baselines, trend lines. And the system says there's a UTI risk and a depression risk here. So let's look at the trends. So for this resident, you can see that the social interaction duration kind of goes all over the place, and she's out of baseline, or he's out of baseline these 2 days. So they're simply spending less time with their friends. The average bathroom duration is elevated significantly. The physicians tell us that it's not necessarily how often residents go to the bathroom, it's their duration in the bathroom. So this is the reason this system is identifying this patient as having a UTI risk. There's a number of things that are tracked with these residents, and let's look at some of them. If I look at the dashboard, the pulse rate is measured and tracked over time. The activity score, as I just mentioned, how much time they're walking compared to the last 24 hours, how much time they spend in the dining room, what time they went to bed, what time they got up, how many times they went to the bathroom, how many times they got up at night to go to the bathroom. There is social interaction. And then as we add biometrics to the system, we're adding weight, temperature. Right now, CarePredict is working on a patch to tie in blood glucose monitoring 24 hours a day. Pulse oximetry is working now, so that's available today throughout the system. So those are the added devices and biometrics that are coming into the system in the future. Other features of the system is, besides tracking the staff members, is to be able to track visitors that come into the buildings. We don't use that in this facility here, but we do see a future when, as visitors come in to see their parents or to see their loved ones or whatever, that we're logging them and who they're talking to in the building. Again, as part of the contact tracing responsibility, I think that we need to have in place. So that'll be forthcoming. So that was a demonstration on CarePredict. Now, how does it fit into the whole system? This is a confusing diagram that attempts to show how we're utilizing the system. So Aspire Clinical Intelligence is an Edgewood company that was started back during the pandemic in 2000. It's the central engine behind AI throughout the system. So essentially what we've done is we've created a separate EHR that's pulling data through APIs from current electronic health records. Alice is the one we use. We can also communicate with Point-Click Care and Residex. And the information in the electronic health record is shared with Aspire. So medication profiles, diagnosis, comorbidities, all that clinical information gets put into the system. It also is designed to tie in with the physician EHR system, which is where all the billing information come and the detailed care level from the caregivers. So things like CPT codes and RAF scores and things like that. The ACO is tied in so that the Aspire system can actually see a resident's expected spend by Medicare based on their CPT coding, their RAF scores, their adjusted factor scores. But but the system also sees right down to the patient's arm. So the data that's being generated from CarePredict, then CamiVision, and some of the other RPM devices we can connect to CarePredict, including the daily scale that we have under development. All that information can reside in Aspire. The users of Aspire then are the primary care physicians. They also have access down here to CarePredict. And the home health hospice therapy providers have access to CarePredict. Any physician who has a need to know, according to HIPAA guidelines, should have access to Aspire. So in theory, if one of our residents goes to the hospital, all the data that we're generating on that resident should be available to that healthcare provider in the ER or the hospital. The CarePredict system is directly used by the nurses, the caregivers. Patient family can have access to portions of it. And it is tied into our remote nursing service platform. So the RNs in the remote call center have access to all of this information. Okay, so with this added information, we can also look at the value that we're providing both in quality and in cost. These are actual results from what we're seeing. In blue here, what you're looking at is the length of stay in assisted living, whether it's basic care, memory care, or assisted living, in the Edgewood facilities that have nurse practitioners and the remote data accumulation capabilities that we have. The orange is where we don't have it yet. For instance, Helena, Montana. We haven't installed this in Helena, Montana yet, so they're down here. We haven't installed it in Dickinson, North Dakota, so that's down here. The industry average for length of stay in assisted living happens to be about 18 months. At Edgewood, it's much higher than the industry average, and it's increasing. So I don't know if our residents are living longer, but they're living longer with us. And because of assisted living is a lower cost level of care compared to obviously to a hospital or to skilled nursing, then reductions in cost should go with it. This is the legacy medical remote nurse call system. These are the number of monthly calls that the call center gets. As you can see, since last year, it's been growing significantly. So currently, the call center is fielding about 9,000 calls a month. If I do my math, that's about 290 calls a day. And from those calls, only 1.6% of the calls result in an ER transport. In most cases, the calls result in the call for the nurse practitioner to come in and see the patient or to do a telehealth visit and to keep the patient in their home as much as we can. How that translates into cost savings is something we've been working on. We estimate that without legacy nursing and the programs we have in place, we would have seen 3,500 ER visits come from our buildings in the last 12 months, last 9 months. I mean, we only saw about 1,500 to 1,700. We believe we've reduced ER transports by 57%, and we've also reduced hospital readmissions uh, to a large degree. We have that data, and the data shows us that our hospital readmission rates out of Edgewood facilities and other facilities that use legacy medical are significantly lower than the average. So that translates into cost savings. So I'd like to share with you the real value of that cost savings. So this is the actual ACO performance from Legacy Medical in 2025. And essentially what it is, this is data from Medicare. It's not from us. So the Medicare cost savings is simply the difference between the expected Medicare spend less what was actually spent on these residents over the last year. And by medical spend, Medicare spend, I'm talking about all services, hospital services, ER, medications, everything that Medicare pays for is lumped into this number. So for 2025, the first year Legacy Medical was in operations, there were 468 residents that were under the ACO. So it was a limited number of residents that fell under the ACO. Not all apply. Not all can have access to the ACO. Medicare expected to spend 16.7 million on these residents. That's 35,000 residents, which ties fairly close to our RAF score of about 2.4. The actual spend was 11.8 million. So the Medicare savings for this population was 4.9 million, or over $10,000 per resident. The Medicaid cost savings, we don't know what that is, but we know that we're saving Medicaid dollars as well, and we just don't have data on those numbers yet. So thank you for your time. Hopefully this demonstration in PowerPoint uh, is instrumental in showing you how we can, number one, improve quality, and we can reduce cost and treat people at the right place at the right time in the right setting, uh, and reduce costs for the Medicaid system as well. Thank you.